Alright, so this is Jeremiah. He's going to be my patient today. He's a 40-year-old that had a right Achilles injury. It was injured during basketball and it was repaired about 6 weeks ago. He was immobilized in 20 degrees of plantar flexion, so he's having trouble with the dorsiflexion. So I'm going to do thermal effects on the ultrasound to go ahead and get the tissue extensibility and the range of motion back in that ankle. So, hi Jeremiah, my name is Rachel. I'll be your PT for today. So I just have a few questions for you to make sure this is an appropriate treatment for you. So have you had any cancer, history of cancer? Okay, what about any unexplained weight loss? Any previous surgery or injury to the ankle? And what about any joint cement, blood clots? And are you apprehensive about using this? Okay, and are you okay if I touch your ankle? Okay, perfect. So basically, I'll go ahead and lay you down on your stomach. Is that going to be okay for you?
That's fine.
Okay, so I'm just going to go ahead and use this ultrasound. And so I'll put some gel on it, and you'll feel a little bit of a cold sensation with that. And then once the treatment gets started, you might feel a little bit of warm. It should feel like a gentle massage, but if it starts to burn or hurt at all, just let me know, and I'll either adjust the settings or I will go ahead and stop the treatment. So I'll go ahead and have you, you can go ahead and lay your stomach for me.
Really address that impairment in her muscle function.
And then I'm going to go ahead and put this pillow under your leg. Does that feel okay?
Focus on that muscle.
And then for the pre-test and post-test, I'm just going to look at the range of motion, and I'm going to do a manual muscle test, and I'll compare the pre and post, and then I'll also check with his left ankle so I can see how much difference is between the left and the right. So for my settings, I'm using the thermal ultrasound, so I'm going to have a 100% duty cycle. It's going to have a 0.5 watts per centimeter squared, and the frequency is going to be 3.3 megahertz. So I will go ahead and start the treatment. Okay, you might feel a little bit cold right now. So I'm going to work in an area that's about 2 times the size of the sound head, just kind of spread out the gel. And then I'm going to go ahead and start the treatment.
So I just want to ask a couple questions that I'm going to say while we do this. Do you have any apprehension for that? And then any blood pressure?
Does that feel okay?
Yep, feels good.
Alright. And then normally this treatment would last about 5 to 10 minutes, but just for the sake of time, I'm going to go ahead and end the treatment.
So, I just want to also inform you that I'm going to touch you and move around on the table and maybe set up with some electrodes to help that muscle contract. I'm just going to go ahead and
Alright, and then you can go ahead and sit up. You're all finished for today. Did you have any questions?
No.
Alright, you feel good? Alright, perfect. And if you develop any redness or any weird feelings in that area, please let me know.
So,
Alright.
at this point,